hosts tonight will be talking with commissioners and special guests about the creation of the new Arapahoe County Public Health Department. You may already know that the county is building its own department after Douglas and Adams counties left the current health department structure shared by the three counties. Last fall, our county commissioners began the formal process of creating a single county health department, which needs to be up and running by January 1st, 2023. Tonight, they will give us an update on some notable actions they've taken in just the last few weeks. If you'd like to ask a question about the creation of the health department, you have a few options. If you're on the phone, you can press *3 and an operator will get you in the queue. If you're watching and listening online, you can type your question into the box under the video player. And if you're watching on Facebook, you can type a question in the comments and they will be included in the queue. Now, to frame this complex issue for us tonight, I'd like to bring on the chair of the Arapahoe County Board of Commissioners, Nancy Jackson. Commissioner, good evening.
Good evening. Thank you, Roger, and welcome, everyone. On behalf of my fellow commissioners, I'd like to thank you for joining us tonight. The creation of this public health department is one of the most important actions this board has taken in recent years. And while the timeline is pretty aggressive, we are meeting each of our deadlines to make sure we're ready to go in the new year. Before we dive in, I'd like to take a moment to introduce some of the people on the call. We have 4 of the 5 Arapahoe County Commissioners, myself, Terry Warren Gully, Nancy Sharp, and Bill Holing. Commissioner Jeff Baker could not be with us tonight. We also have a consultant from the Ottawa Group who has been working closely with us on this transition. Sarah Miller has deep professional background in public health and has been instrumental in helping us build an understanding of the work that needs to be done. We also have some staff subject matter experts on hand to answer questions. And now, before we tell you about all the things we've accomplished, let's stop for a moment and ask our first poll question. Roger?
Thank you, Commissioner. It's easy to participate. All you have to do is use your telephone keypad to enter your response. And if you're participating online, click your response. So here's that first question. Prior to COVID, how often had you interacted with your local health department? Press 1 for never, press 2 for sometimes, and press 3 for regularly. We'll let everyone know how you voted in just a moment, but now let's toss it over to Commissioner Nancy Sharp. Commissioner?
Thank you, Roger. And let me set the stage for our discussion. I know with some background, I know some of you all have probably heard this before, but it's always important to give a little background. So Tri-County Health Department has been our public health agency since 1948. That's a 73-year relationship. Last fall, Douglas County announced its intention to form its own health department by leaving Tri-County Health. Shortly thereafter, Adams County also announced the same intention. So it became clear that we would need to, in Arapahoe County, would need to move forward with creating our own single county public health department by January 1 of 2023. That's how we've decided much of our time. That's how we've dedicated much of our time since the beginning of this year, and we've been able to get a lot of things accomplished. It's kind of amazing how quickly things have gone and how much information we've had, and I want to personally thank the Ottawa Group because they have helped us tremendously in this process. So we recently announced the services that will be provided by Arapahoe County Public Health. These services are the most critical and based on community need. These services fall into 2 broad categories: consumer protection and community health, and you'll recognize many of these when we talk about them. Consumer protection includes services such as restaurant and child care inspections, extremely important to all of us, communicable disease surveillance and control, emergency preparedness and response, and access to birth and death certificates. Community health, on the other hand, is focused directly on working with residents. It includes services like the Women and Children Nutrition Program, immunizations, family planning, tobacco use prevention, and other educational programs, testing for sexually transmitted infections, and public health nursing. These services will sound familiar to those of you who've interacted with the Public Health Department in the past. And speaking of which, Roger, I think it'd be interesting for us to know and for you to share the results of our first poll to see who has interacted with Tri-County Health in the past. Thank you.
Thank you, Commissioner. So here we asked, how often have you interacted with your local health department prior to COVID? 61% of you said never, 29% said sometimes, and 10% of you said you interact regularly. Thank you. We'll have another question later in the call, and as a reminder, to ask a question, press *3. You'll be connected to an operator who will get you in the queue. This may be a good time to take our first question of the night, and it came online from Daryl from Inglewood. He submitted the following question. He asks how Arapahoe County Public Health will handle the ongoing realities and education of the COVID epidemic. Commissioner Jackson, would you like to take that question? Commissioner, you may be muted. We're not hearing you.
I think I was muted. I'm so sorry. Okay. So somebody has to do that. Yes, thank you, Roger. And thanks, Daryl, for that question. I think a lot of people are wondering that same thing. But before I answer that question, I want to remind everyone that Tri-County Health Department will continue to serve the public health needs of Arapahoe County residents through the end of the year. You can still receive your public health services at their clinics, and they will respond to any public health emergencies. And they will continue to provide updates on COVID. With that said, it's difficult to know what the COVID situation will be when Arapahoe County Public Health takes over on January 1st. Certainly, we all hope that COVID has progressed to the point where we can all live our lives with minimal disruption. But what we do know is that we will continue to provide COVID immunizations for those who are interested in receiving them, as well as ensure that our community is educated about any emerging information about the disease. We will monitor data and listen to the advice of qualified medical professionals on how to proceed. Thank you again for asking that question, Daryl. And Roger, would you please remind our listeners of how to ask a question?
I sure will. To be placed in our question queue, press *3 on your phone and you'll be connected to an operator. And if you're online participating, you can submit your question there. Before we take another question, I'd like to ask Commissioner Warren Gully, can you tell us about some of the most recent developments for Arapahoe County Public Health?
Yes, sure. Thank you, Roger. In March, the commissioners established what we're calling a foundational board of health. And the board's charge is to complete operational items in preparation for next year, such as hiring a director, developing a budget, and establishing bylaws to get us all set and ready to go. In April, we began a formal search for candidates, and we really received some excellent ones. So on June 14th, we named 5 individuals to the Foundational Board of Health. Commissioners Nancy Sharp and Nancy Jackson, who you've already heard from this evening, they will be serving on the Board of Health. Their terms on that board will expire in December 31st of 2023, rounding out our Foundational Board of Health is B.B. Kleiman, whose term will expire December 31st of 2025, Dr. Heather Signorelli, with a term to expire on December 31st of 2025, and Sean Davis, who will serve through the end of 2027. Dr. Signorelli could not be with us tonight, but we have the other board members with us on the call, which is really exciting. So would each of you take a moment to introduce yourself? Bibi, can I ask you to go first for us, please?
Thank you, Commissioner. Good evening to everyone listening and watching online. I am Bibi Kleiman. I have been the CEO of Doctors Care for more than 20 years. My work is dedicated to improving health access to low-income individuals. My job is a reflection of my passion for supporting and creating a fairer society in which all members of the community have access to the health care and coverage they need. I am confident that we can build a system that meets the public health needs of Arapahoe County and grow that system over the next several years. I'm really looking forward to working with our community. I'm going to pass this on to Sean. Do you want to go next?
Yes, thank you for that, Bibi. Good evening, everyone. My name is Sean Davis, and by way of background, I have about 17 years of experience in healthcare and working with nonprofit organizations around Colorado. My focus and a lot of the work I do in consulting is around health equity. I'm currently a commissioner for CDPHE's Health Equity Commission. I've worked with numerous organizations throughout the state, around 200, and I currently work in about 22 counties around the state of Colorado on public health issues, health care, and health equity issues. And so one of the things I believe is that this is an exciting and excellent time to address public health in Arapahoe County. We have the opportunity to do some exciting things, and I'm looking forward to the work ahead. I'm going to turn it back over to Roger. Roger, I'm going to give it back to you.
All right, thank you. Let's move on to our next question. From the queue, we received the following question from Shannon online, and she asks, are you considering using existing county resources for the transition? How about, who'd like to take that question? Commissioner Jackson, is that something you could take? Or Commissioner Warren Gully?
I can take some of it, and then I think our finance director, Todd Weaver, is on the line, and he can probably go into more detail. But we have taken some of our general funds and put it aside this year and next year to save for the new health department. We're also being really careful to apply for the same grants that Tri-County Health had. We're working with CDPHE, the Colorado State Health Department, for their assistance with grants and transition costs. So we're doing everything we can to keep the costs minimalized. Maybe, Todd, do you want to just say another word or two about that? But that's a really good question, so thank you.
Sure, Commissioner Jackson, thank you. I think to get to the point of are we using existing county resources, as Commissioner Jackson pointed out, we had already existing funding that went to Tri-County Health. We'll be applying that funding to the new health department. As she said, we're looking for all different types of sources of grant funding, some of those same ones that Tri-County Health may have received in the past, but also looking at new sources of revenue. And to be honest, many of the resources we're using to get this health department up and running are existing county resources, whether it be from my department in finance, from human resources, from information technology, from all over the county, to try to get our health department up and ready to go by January 1st of 2023, when we have the baton passed to us from Tri-County Health. Thank you.
All right, thank you very much. Again, as a reminder, you can press *3 on your phone to ask a question, and you can submit your questions online if you're joined us either on Facebook or online. Commissioner Holen, can you take a minute and tell us about staffing for the health department?
Roger. Last week, hello?
Yes, go ahead.
Good. Last week, the Foundation Board of Health took an important step by naming Jennifer Ludwig to be the Public Health Director. Jennifer has an impressive background in public health having served most recently as Deputy Director of Tri-County Health. Prior to that, she was an Executive Director for Eagle County's Public Health Department. She has also served in Pueblo County's Local Health Department. She has more than 25 years of experience in public health administration. She's uniquely qualified to undertake the dynamics of a single county health department and the inner workings of Tri-County Health. She also has significant reorganization experience that will be instrumental over the coming months. Because Jennifer is not a licensed physician, we have issued an RFP for a qualified medical officer who is required by law. We are reviewing responses now and hope to have our medical officer chosen soon. Jennifer, can you drop in and say a few words?
Yes, good evening, Commissioner Holen, and good evening to all the residents that have tuned in tonight, and thank you so much. It is such an honor to serve Arapahoe County in this role, and I am really looking forward to working with the Board of Health as we establish our vision and open our doors of our new public health agency on January 2nd of 2023. And one thing that is very important to me is engaging with the community in meaningful ways as we build this new health department. We really need to hear from you, which is why we host events such as this. So even though our opening day is less than 6 months away, I can tell you that we will be ready. We've been working very hard, and we are looking forward to seeing familiar faces and new ones. So keep an eye out. We will be hopefully coming to a community near you. So back to you, Roger.
All right, thank you. Let's go to a couple questions next. And congratulations, Jennifer. Welcome aboard. All right, let's hear first from Richard. Richard, go right ahead.
Yes, hello. Thank you for taking the call. My question is, as there appears to be another resurgence of COVID, another subvariant, are there still places in Arapahoe County where one can go for a test, or are all tests now having to be done at home by citizens?
I can take that one, Roger. This is Nancy Jackson, and Richard, until January 1st, Tri-County Health will remain where it is with the same services that you're expecting. But so you don't have to just rely on at-home tests. But let me transfer the call over to Jennifer Ludwig, who actually still works for Tri-County Health, and she can explain.
Yeah, thank you, Commissioner. And yes, absolutely. Tri-County Health Department will be providing all services until the end of the year and the transition occurs. For COVID testing, the best resource that I recommend is going to www.tchd.org. And at the top, there's a button that says Coronavirus COVID-19. You click on that, and there we have a page of all the free COVID-19 testing sites in Arapahoe County. There's a link that you can click on the map of all free sites, and there are still a handful of sites that are offering testing, so that does not have to be done at home. And depending on who your medical provider is, you can also have testing done at your medical provider. But there are sites across the state and in Arapahoe County. So I recommend visiting Tri-County Health Department's website and its COVID webpage for testing locations.
All right, Jennifer, while we've got you, we have a question from Ben that came in on Facebook. And he asked, what will happen to Tri-County Health when Arapahoe County's health department becomes active?
I was on mute. My apologies. Can you repeat the question for me?
Sure. This came in from Ben on Facebook. What will happen to Tri-County Health when Arapahoe County's health department becomes active?
Thank you very much. And Ben, thank you for that question. Tri-County Health Department will be dissolving at the end of this year and transitioning into the 3 counties that have been served have been Adams, Arapahoe, and Douglas counties. Douglas County formed its health department last year, and we are transitioning services to Douglas County this year. Most of our services will be transitioned by the fourth quarter of this year. The agency, Tri-County Health Department, the current agency, will be dissolved as of 12/31 of this year, so the end of the year. And everything will be transitioned, and the 2 new health departments will be fully stood up, one in Adams County and ours in Arapahoe County. So thank you for that question.
All right, let's, I think Commissioner Warren Gully, this one might be a good question for you. It came in online from Michelle. Why can't we offer all the same services that were available under Tri-County?
Michelle, that is a really great question. And what I will tell you is that we are doing our very best to provide services with the money that we know that we will have at this point. Now, that is to absolutely recognize that there will be some services that we may not be able to right away offer, but we are very hopeful that over time that we will be able to become available and eligible for more of the grants that are out there for us, and we can keep building up our services. It's that some of the cycles of the grant funding and such are not available in the same cycle that we are working on. So I know that there are some services that our community really enjoys, and we want to make sure that we continue those. And so that's where it kind of comes in, where we discuss what can we utilize from some of our county funds, and what are we going to be utilizing from grants and such. So we are going to be working very much to make sure that over the long term, we're able to continue the services that Tri-County Health has offered in the past, and probably new things that we discover that our community wants. So thank you, Michelle, for the question.
All right, thank you. Again, a reminder that you can press *3 if you'd like to ask a question. We're going to hear next from Kathy on the phone. Kathy, go ahead.
Thank you very much for taking my call. I wanted to say I am excited about Jennifer leading this group. First of all, with her credentials, we can't lose. But I do have a question about a deputy director that might be instigated into this process. And also, what is the diversity of the group that's leading the Public Health Department for Arapahoe County? In other words, are we being inclusive and very diverse in our attempt to create this health department with Latino, Black, and Asian and other cultures? I believe that is very important because we do have such a diverse, community, I guess. So those are my questions and my thoughts.
All right, thank you. Sarah, do you want to take that? You might be muted, Sarah.
I feel like I'm not muted. Are you able to hear me?
We are now.
Okay, super. Hey, Kathy, thanks for the question. I really appreciate it. We are in the process of selecting the senior level staff that will support Jennifer in her work as the leader of the Public Health Department, and some of those announcements will be coming out in the next few days. What I want to emphasize for you is we deeply recognize the importance of having a diverse staff and diverse outreach folks on our team at Arapahoe County to be able to do the critical work to reach some of the communities that you highlighted. And it's really important to know that there are going to be some some postings for positions that are available within the Arapahoe County Public Health Department. And we are going to do our best to outreach to some of the communities and reach through those communities and around those communities to try to really recruit people that can best represent those communities and help us do the best work to address the health equity issues that you're bringing to light. So it's one of our top priorities. The county commissioners of Arapahoe really underlined that and highlighted that as making sure that we prioritize that. And so it is on our list, and we look forward to having you see those opportunities post as they do on the health department website for Arapahoe County. Thank you.
Sarah, while we've got you, we also had an online question that came in from Karina. And she asked, why did the board select someone who isn't a physician to lead the new department?
Great. I think I heard it was Karina that asked that question, so thanks for giving me the opportunity to answer that, and thank you for the great question, Karina. The state of Colorado allows for the top administrator of the public health departments to be either a public health administrator or a public health administrator who is also a physician. And at this time, we were just thrilled with the qualifications that Jennifer was able to bring to us, and thought and know that we can match it with providing her a counterpart who is a physician and spends their time thinking about those things full time to counsel Jennifer and work through that. And the state law allows us to do that. And we're also very proud that we have Dr. Signorelli, who wasn't able to be on the call tonight, but she is sitting on the Board of Health specifically, and we will also be using her knowledge and expertise to guide us as we move forward.
Okay, this might be a good time to take a minute to ask another polling question. Again, use your telephone keypad to enter your response, or click if you're online. Here is that question. Now that you're hearing more about all of this work, do you believe Arapahoe County is on the right track in building its new health department? Press 1 for yes, press 2 for no, and press 3 if you're not sure. We thank you for sharing your opinion, and we're going to get back to some questions. Again, *3 on your phone, or submit your question online or on Facebook. And next up is Gail. Gail, go ahead.
Hi. Hello? Am I coming through?
Gail. We hear you. You are. Go ahead.
Okay. We hear you. Okay, I was going to ask, is there going to be a senior dental clinic like there was with Tri-County? Is there plans for that, or is that in the scope?
This is Nancy Jackson again. We are taking a look at that because we understand how important that program is. And just by the way, the other two counties were not providing that service, but we thought it was important enough to fund that. So we're also working we're currently talking to Stride Medical, if you're familiar with them, to see if they can help us with that. But we are, as I say, we are quite aware of the importance of that program and hope that we can continue that ongoing.
Okay, thank you, Commissioner. Let's go to an online question from William. He asks, how much will all of this cost? Todd, maybe you could take that question.
Yeah, thank you for your question, William. That's a paramount concern to me as a finance director. I think the goal of the county is to try to fit this health department's cost within the current amount that we're funding for our existing health department with Tri-County Health. Now, that starting a health department from scratch, there's a lot of complexities that go into that. There's a lot of services that have to be stood up from ground zero. But when you think about public health departments along the Front Range of Colorado, about 30% of their funding comes from the local government, so that would be from Arapahoe County. And about 60% of the funding comes from grants and other funding sources, and 10% come from fees and charges for like vital records, birth and death certificates. So we're trying to establish a baseline for all those revenues that are coming in, and then try to tailor the services for the citizens of Arapahoe County that fit within that revenue profile. So there's still a lot of work to be done there, but we're working on trying to make it as affordable as possible to fit within the county's budget while still providing a robust amount of services for the citizens of the county. So thanks for your question, William.
All right, thank you, Todd. Here's the results of our second survey question. We asked, now that you're hearing more about this work, all the work that's been done. Do you believe Arapahoe County is on the right track in building a new health department? We're happy. 53% of you said yes. Only 6% of you said no, and 41% of you said you're not sure, which we hope we're answering some of those questions for you tonight. All right, here's a question that came in online. Perhaps Commissioner Jackson could take this. It came in from Steve. Will you use Tri-County's facilities for our new health department?
Thank you, Steve. I think there's probably a lot of people who are wondering that same thing. At this point, we're anticipating that the clinics within Arapahoe County will continue serving our residents. So that includes our Broadway location in Englewood and the Altura Plaza in Aurora. We understand how important it is that our residents don't lose access to the resources that they've come to count on. So we are currently working on making sure that we can use those facilities.
Okay, again, *3 on your phone if you'd like to ask a question live. Here's another question that came in online. This one came from Susan. She asked, how will the new Arapahoe Health Department keep us informed about its services and actions once it transitions into 2023 and beyond? Will you continue with town halls like this one?
This is Commissioner Warren Gully, and Susan, I really appreciate that question because as we know, this is a big transition for us, and I hope that people feel that between the website that we've designed on our larger Arapahoe County website and these types of town hall meetings, as well as going out into the community, which we just did a kind of a conversations with commissioners group moving into the community and having in-person meetings to talk about this, we will absolutely be continuing these types of forms of communication, not only in our newsletter, but in town halls such as this one, trying to reach out to our media partners to make sure that people are aware and informed through the different media sources, and continuing to reach out into our communities. So it's a wonderful question, and it is absolutely our intention to continue to work on making sure that people are aware of the transition. But once the transition happens in January, what types of services are we offering, and how do we make sure that we're getting feedback from folks to offer the correct services for our community? So thank you, Susan, for the question.
All right, let's hear from Karen on the phone next. Karen, go ahead.
Hi, I'm just wondering what's happened with Dr. John Douglas, who worked so hard and so well for us in the early days of the pandemic.
Jennifer, can you take that one?
Sure, happy to. And Karen, thank you so much for that question. And I'm so glad that you have followed along during the pandemic and got to listen to Dr. Douglas. He really was our champion and face for Tri-County Health Department as he led us through COVID. He is still super active and leading Tri-County Health Department, very busy with assisting and working through all the logistics with the dissolution of Tri-County Health Department and continuing to provide guidance to the entire agency and the Tri-County Board of Health and the communities that Tri-County Health Department serves through COVID and other emerging infectious diseases. So he is still at the helm of Tri-County Health Department working through the dissolution and running the organization. So he has not gone anywhere, and he is still very busy and very committed to ensuring a smooth, successful transition and also ensuring that public health services continue to be provided throughout the region that Tri-County Health Department serves until the end of the year and the transition occurs. So thank you for that question and your concern.
Thank you, Jennifer. Todd, this question came in from Laura online, and it probably should go to you. Here's her question. Can you use ARPA funding for any of this transition?
Well, that's a great question, Laura. Yes, for those of you who don't know, the ARPA, or American Rescue Plan Act funds, were essentially funds that were provided by the federal government to many local governments, and Arapahoe County was also the beneficiary of some of those funds. It's a sum of money that we have a period of time to use for one-time costs, and when we're looking at the health department, there's a lot of work left to be done. Folks like myself and county staff here working with Jennifer will be rolling up our sleeves and figuring out how to provide these services, and where we find a match with transition or one-time costs that we need for the health department, we'll be trying to find ARPA funds that are eligible to be used for that use. So we'll be examining that and hopefully applying some of those ARPA funds to this use. So thanks for your question, Laura.
Thank you, Todd. Let's hear from Jane next. Jane, go ahead. You're live with our audience.
Hello?
Hi, Jane. You're live. Go ahead with your question.
Oh, my question is, are there any plans to provide services to our seriously mentally ill citizens and their families also? And also, Governor Paulus has a new cabinet-level department, the Behavioral Health Administration, and are there any ways to coordinate care for the mentally ill between the new county health department and the state Behavioral Health Administration?
I can take that one. Yeah, thank you. Thank you, Jane. This is a really important question, and I appreciate you asking it. So the health department does not provide direct service. What they do is they promote public health for the whole community. So we have a number of providers in the county, Aurora Mental Health, All Health Network, and a whole lot of private and small nonprofits that provide mental health. The Behavioral Health Administration is going to help us coordinate all of that, and hopefully their one of their mottos is, no wrong door, so that people who go to the BHA, as it's called, will be able to find the services that are appropriate for them. That being said, the health department sits on a number of those committees. They are very active in this space, and while they don't necessarily provide direct service, they help with communication, they help with coordination, and community assessments as well. So the health department is a true partner in providing mental health services, behavioral health services for the entire community. But they don't hire mental health therapists or psychiatrists or anything like that. That is what the behavioral health organizations do. But it's important, and they're right there at the table. I hope that helps.
Thank you, Commissioner. We have 15 minutes left, so there's still lots of time to get in the queue. Just press *3 on your phone. You'll be directed to an operator who will take down some information and get you in line. Let's hear from Alec next. Go ahead, Alec.
Hey, how's it going? My question is, the new health department that you're creating, I know Tri-County Health hired a lot of people that were in the communities. Is that going to carry over, or are some of the jobs going to be outsourced to people not even in Colorado?
Jennifer, how about you trying to
take
that?
I'm happy to take that. Thank you, Alex, for that question. Currently, Tri-County Health Department employs about 380 people, and all with extreme talent and expertise. And there are the jobs opening up and the opportunities opening up in Arapahoe County. We definitely want to be able to recruit that talent. So we are looking to fill those positions with as many Tri-County Health Department employees who know the community, have been working in the community, serve the families that live in Arapahoe County and have the expertise and talent that we are looking for in our new health department. So we absolutely will be looking to fill those positions with Tri-County Health Department. And knowing that Tri-County has been serving 3 counties and now there are 3 new health departments, there likely might be more positions than what we even have employees to fill. So there will be opportunities for other individuals to apply outside of just Tri-County. But right now we really are just looking to local applicants and candidates and to the talent that currently exists at Tri-County Health Department. So thanks for asking.
Thank you, Jennifer. Let's take a question that Ben submitted on Facebook. He asks, he lives in the city of Aurora, and the city is in 3 counties. The dissolving of Tri-County Health will be confusing to residents as to which health department to contact. How can this be mitigated? Commissioner Jackson?
Thank you. Yeah, thank you, Ben. I also live in Aurora, so I understand completely what your question is. And I remember growing up in Aurora that was also an issue, even when we had Tri-County Health. So we are going to be working with the city of Aurora and working with our sister counties, if you will, to kind of coordinate that. We don't have answers for you specifically right now. We're a little bit early in the process, but we are very aware of that issue. And as I say, we've been coordinating with the city of Aurora, the mayor, city council, and others to try and see how we can smooth that issue out.
All right, we've got another online question, this one on Facebook from Kathy. Sean, maybe you could take this question. Kathy writes, asks, will there be any positions for individuals to volunteer? So we as seniors with much administrative experience can give back to our community to make this new health department a strong one. Great question. Sean?
Yes. Yeah, thank you for the question, Kathy. I would say also by way of background, Kathy, I have a master's in gerontology, so I have a passion for older adults. I think there's going to be numerous opportunities for seniors or older adults to participate, and I hope we can look for opportunities in administration and mentoring in other areas to really build on the expertise of the seniors in Arapahoe County to be able to contribute in meaningful ways. But we anticipate there will be numerous volunteer opportunities.
Thank you, Sean, and thank you, Kathy. We're just thrilled that you are interested in volunteering. Let's go to an online question from Gail. She asks, is this a nonprofit organization? Commissioner Warren Gully.
No, the Arapahoe County Health Department is not a nonprofit organization. It is an organization that is funded through state and local funds and functions as a government entity. But what I would say is that we do work with a lot of nonprofit partners in our community. Much of what we do in Arapahoe County does work with our nonprofit community because they are able to offer services that we are not. Commissioner Jackson mentioned earlier on our partnerships that we have with many folks in the nonprofit community around mental and behavioral health services. And actually, Bibi Kleiman from Doctors Care is a perfect example of this and how we work with partners in the community to provide services that we as a governmental entity cannot. So thank you very much for the question. Hopefully that answered it.
All right. Thank you very much. We are at the end of the call tonight. We had a lot of great questions, and we really appreciate everyone taking time out of your schedule to join us this evening. If you have additional thoughts you'd like to share about the formation of Arapahoe County Public Health, please visit arapahoegov.com www.arpahoe.org/health. There's a wealth of information there and opportunities for you to share comments and ask questions. So on behalf of the commissioners and our guests tonight, we thank you for joining us and wish you a very wonderful evening.